Well, thank you, Madam Speaker. I'd like to thank the honourable member for his speech, and I agree with him that we needed a lot more transparency with this whole vaccine rollout and with the plan. And I would have liked to have seen contracts for manufacturing of vaccines in this country. I agree that we should be using Canadian ingenuity. And I would ask him, I've heard a number of his colleagues today talking about the great legacy of Canada and our medical history. You know, about insulin, about diphtheria, about we were a world leader providing vaccines to countries around the world. And the lab that was responsible for that was Connaught Labs. It was a public lab that was established in 1914, and it had a long-running legacy until it was privatized in 1984 by Prime Minister Brian Mulroney, a conservative Prime Minister. And I would like to ask him if he'd like to see this model of a public lab reintroduced in Canada so that we can be on top of these things when we face the next pandemic or the next serious health issue.
Honourable Member for Foothills.
Thank you very much, Madam Speaker. I want to thank my colleague for his question. And I think what he's talking about is the root of a larger issue that we need to discuss. I would like to see, when we're back on our feet a little bit, that we have a royal commission investigate the COVID-19 pandemic. What worked? What didn't work? Where are the voids in the system? And vaccine manufacturing, distribution, all of those things should be part of that. So I don't want to make that contention now, but I think there should be a very thorough investigation of how the Liberal government handled this situation and what can be improved in the future.